can't do anything simple. We got to take the 10,000 pound thing and crane it into the 7th floor. Yeah.
In 1996, amid deep uncertainty in the Alberta healthcare landscape, a bold vision emerged. 4 distinct radiology practices chose unity over division, merging to form Medical Imaging Consultants. It was a foundational shift that brought together hospital-based teaching groups and community clinics into one cohesive company.
I think at the time when we formed it, there was a lot of uncertainty in how things were going in healthcare. There was concern that the government was going to kind of pitch a lot of the radiology groups against each other, and we thought it was better to be strength and unity rather than be divided. It also, I think, gave us the ability that the practice could become much more expansive so that you had more opportunity to do what you want.
With Ivan Olsen as CEO, the newly formed entity began its operations with key locations like the Allen Clinic, Grandin, and the High Center. But blending 4 unique cultures meant navigating a steep learning curve for everyone involved.
In the early years, because we combined so many radiologists, it was a challenge to be one company because we all did everything different. So it was very much a learning experience. And because we did not have automation and the computers that we have today, everyone did things just a little bit different. We really got to know one another, and that's how we knew. And we had Grayman's group, we had the Royal Outlet group, the University group, and then we all amalgamated, so there was a lot of growing pains, but they're a good group.
Just rip it open, sure.
Expansion followed quickly. In 1997, MIC opened the landmark College Plaza clinic, famously hoisting a nuclear medicine gamma camera through the air by crane to the 7th floor.
And the first clinic that we opened as a group was College Plaza. For us, it was a huge big thing for the group at the time because we took 2 floors of that building, a very large space, and we also put in, the first private MR in Edmonton.
When we moved from the founding clinic, we went into College Plaza, and then the hip and knee clinic opened up in College Plaza. So it became a really, really busy X-ray department. We had a lot of staff. We all helped each other out. It was a really close group to make the patients, like the 100-odd patients, flow through the department. So we had one cassette that was still required a dark room, and it was our long cassette that we used. Very, very heavy to haul up and down the stairs at College Plaza.
This era also marked the launch of AMOS, the Alberta Mobile Osteoporosis Service, bringing critical screening to rural, unserved communities. By 1999, MIC introduced its very first private MRI at College Plaza, adding a second just 3 years later, under the new leadership of Executive Chairman Dr. Trevor Horwitz. The partnership group had grown to over 60 radiologists, yet the physical demand of the job at the turn of the millennium remained.
The first couple of years was kind of survival for us. I think a lot of it was, was just like, let's get this going and I think about 5 years in, it was like, okay, this is going to work, right? Like you kind of got over the sort of hurdles of how do we make this work and what are the obstacles, and you clear that up, and then it was suddenly, this is going to be good.
As the new millennium progressed, a significant industry shift began to emerge. Behind the scenes, leaders like Dr. Bill Anderson worked alongside the federal and provincial government to secure funding for the digitization of healthcare.
when I started in radiology, everything was filmed. So we had cut film for everything, for CT, for MR, for ultrasound, and all the plain films. So you had trolleys full of bags full of the patient's film and their prior films. You would, pull those up, put them on a view box, put up the previous, funnel through a bag to try and find the reports, get your hands all paper cut up because, you were pulling papers out, and report them on cassette tapes with paper requisitions. You'd hand that off to a transcriptionist, they'd type it, and they'd bring the reports back to you to sign some point later in the day. Compared to now where everything we have is digital. I mean, the younger radiologists have never seen a film. They have no idea what a film looks like. And it's much more efficient and much better.
I have helped and scanned thousands of patients in my career. I have mentored and supported many colleagues that have gone on to be team leaders and site managers in our company. I love what I do and who I work for.
We all go through bad days. How could persevere?
If you could go back and give yourself one piece of advice, what would it be?
Relax. I think overall, I think those first few years were pretty stressful for all of us. There was a lot of worry and concern and, gee, is this going to work? Should we be here? If I go back to look, relax, it's going to be fine.